I'm Ashley, and I am going to do my final head-to-toe assessment on my patient. For all intents and purposes of this video, she's going to be fully clothed, but if I was doing an actual assessment, I would have her in a hospital gown or something so that I would be able to view her skin head to toe, make sure that there were no cuts, abrasions, masses, discoloration, scarring, anything like that. I'm going to start at the head. I'm going to do this video in 2 videos, so you'll get half now, and then the other half will come later. I would start by, when I first see the patient, I'm Ashley. I'm going to do your assessment. My patient is well groomed. She doesn't appear to be in any distress. She is 10 years old. I know that already. I would look, her hair is evenly distributed. I don't see any cirrhosis, any scabbing, any flakes, dandruff, anything like that. When I'm looking at her, I'm noticing her ears are even and symmetrical. Her nose is midline and symmetrical. Her throat, midline and symmetrical. Okay, does this hurt? Okay. I would palpate the sinuses. I want to make sure that there's no tenderness. There's nothing like that. I would be looking for sclera being moist, conjunctiva being white. I would have my otoscope to look in her ears to see if there's any redness, any bulging. I would feel for lymph nodes. I don't feel anything. Can you move your head for me? Any pain? Can you shrug your shoulders? Okay. We would do a Snellen test. She would stand up. I would have my chart, my eye chart on the wall. We would cover one eye. Can you cover one eye for me? And she would read the lowest line. Now cover the other eye and read the smallest line, and now tell me with both. If we have corrective lenses, we would do with both on and off. I would look in her nose. I'm looking for any drainage, any redness, any swelling going on. Can you close one and the other side? No stuffiness, we're good. Can you open your mouth? Say okay. I'm looking for the hard palate. I'm looking to see that it's moist. I'm looking to see there's no redness, there's no swelling, there's no lacerations even, no missing teeth, loose teeth, anything that could be a choking hazard, especially with a child. You know, you don't want to have a loose tooth hanging out in there. Let's see. Can you, let's see, open your eyes. I'm going to shine a light. I'm checking for perla. I'm checking to see that the pupils are reactive to the light. I'm timing to see that they're close to the same, if not the same. Can you look at that far wall and now look back at my finger? Okay. I'm looking for accommodation. Are her eyes fixing in? If one pupil is not, then we have problems. If one pupil is not reactive, then there could be a head trauma we need to investigate further. Can you follow my pencil? Not with your head, but with your eyes. Okay. Now, can you see this? What about this? I'm checking peripheral vision. I want to know that she can see what's coming at her this way, that her eyesight is indeed good. Can you, let's do the hearing. This is my, just one more. For the Rhine test, my tuner. So I would ding. Can you feel it vibrating? Yes or no? We would try here. I would ding it. Can you hear it better here or here? We're trying to see, can she hear better through bone or through the air? I would also, when I'm going to check her reflexes and her strength, her grip, can you grip me? I would also at the same time be looking at her nails. Are there any clubbing? What's the capillary refill? I want to know that she's not having any hypoxia, that she has good circulation. I would also check radial, check brachial. Okay. Can you push out? Like this way. Squeeze my hands. Okay. Do like this. Push, pull into you. Push away from you. Okay. I'm checking to see, does she have good muscle strength? Can you push? Okay. Pull back toward my hand. Like squeeze my hand. Yeah. Okay. The same. Push up. Push down. Push up. Push down. Okay. I'm checking again as I'm going. I would listen to her chest. I mean, to her back. I'm listening to her lung sounds. Take a deep breath. And again. And again. And again. And again. And again. Her lung sounds appear to be clear bilaterally. I would also listen to her. Take a deep breath and hold it. Take a deep breath and hold it. I'm listening to her carotid arteries. I want to know if there's a whooshing, if there's a brewing there. The rest of this exam will be on the second video.